Hi everyone, my name is Whitney and I'm a dental hygienist, as you can see. If you're new here, welcome. If you've been here before, welcome back. Today we're going to be talking about how to properly clean, like some tips and tricks on how to clean patients' teeth when they have braces. Because of the new guidelines with COVID, we're having everyone do a pre-rinse, but I always recommend doing a pre-rinse with orthodontic patients because it can get, you can kind of swish anything out that might be stuck between the braces. So I would always have them do a pre-rinse. So sometimes you feel defeated because there's a lot to clean with braces. But if you want to not feel defeated, sometimes you could do all the linguals first and then do the braces, get your endurance up or your confidence up. Or what I like to do is do all the facials, all the brackets first, and then do the linguals after, because the linguals are obviously very easy because there's no brackets on them. Just a thought. If you're able to use the ultrasonic right now, I recommend you do. Use a high speed. I keep the saliva ejector just kind of in the corner of the mouth. And then I use a high speed to kind of go around all the facials, because the facials oftentimes have a little more buildup than normal because it's hard to clean braces at home, right? So the ultrasonic really gets around everything. So if you're able to use the ultrasonic, I would use it. If it's too much water, you need a break or something, just raise your hand. Okay. Something I do is first I go around each bracket. If there's a lot of plaque, I just go around each bracket like not a normal cleaning, right? And then after I do that, I go back and do like the normal motions interproximal. First I get most of the plaque off, and then I go back and do the actual cleaning motion. I don't know if that makes sense, but hopefully what you're seeing will help it make more sense. Kind of going around the bracket. If you have a backflow protector, you can have them closed. If you don't, I wouldn't do that on the saliva ejector. Go ahead and close. Thank you. Fun fact, don't forget about the occlusal surfaces. Open. Sometimes the occlusals get some stuff in there, you know what I mean? Go ahead and look up. Thank you. Oftentimes you'll see some stain, right? And it comes off really nicely with the ultrasonic. Please know that there's a camera in my face, so if my technique isn't great, because I'm really looking at a weird angle, and I don't have a mirror right now. But I do believe it's off of the whole tooth, just maybe not the mesial yet. I'm gonna have to move to do the mesial. So next up, when you're done with the ultrasonic, if you used it, now I'm all about the air. I put air everywhere because there's so many nooks and crevices that you might have missed, so then you can really see where you need to get with your scalers now, right? I use the same scalers that I would use if the patient did not have braces. I like my 6-7 for the anteriors, and I usually use some kind of universal-ish type in the back for the posteriors. This part I kind of do as a regular cleaning. Of course the braces are there, but you already got most of the plaque off with the ultrasonic. Now you're just fine-tuning, right? So I think that's the way to think of it. So let's fine-tune. Sometimes I do use a 204S for the posteriors, so that can get in there pretty good too. Whatever you're comfortable with. I'm poking a lot. You're okay? Mm-hmm. Okay. And I do feel like people who go through ortho, like when you're at the orthodontist, you have so much worse things happening that a little poke during your cleaning is nothing compared to right? Yeah. Technically, we always say tightening, but they're not technically tightening. But when you're getting new bands and stuff, sometimes that's very pokey. The wire hits you and stuff. Okay, so now for the polishing. Some people use these brushes, like doing like a makeup swatch. These brushes instead of the cup. Some people like these, but I kind of like using the regular cup. So I'll show you both. So first I do everything above the brackets, and then I do below. And then I do interproximal. So I'm just doing all the facials right now, but I'm going to do all the linguals when I'm done with the regular cup. If you don't have the cup, you can use this on the linguals as well, but not really like I said, the brush, I'm not sure how I feel about it yet. Maybe one day I'll love it, but not usually my cup of tea. do the occlusals with the brush really good. I do like that about the brush. The occlusals, yeah. All right, next up is floss. Everyone's favorite part. I'm not, just kidding. No, but it's fine. What really makes it easy for me, this is something a patient taught me. What I used to do with, you know, the little floss threader, I used to thread it through and just try and deal with it like that. Like, I didn't tie it or anything. What was I doing? What I've learned is that when you do a knot, so like that, I don't know if the camera sees it, but when you do a knot, now you don't gotta worry. It's not gonna fall off. That changed my life. I don't know if I'm the only one. And then you obviously floss the braces. So I like to start in the midline like I always do. I go through like that and then I go down and then do a normal floss, up and down, up and down. It's sometimes nice to have 2 strings of floss to go through because then you're like really going through, but sometimes it doesn't work. Depends on the patient, depends on the tooth. And yeah, we flossed the whole mouth. You love when one tooth doesn't have a bracket. You're like, hey, I can just floss like normal. Let's do all those. Let's do all 4 without the bracket. Nice. Once we're all done, I double check with the air because I'm always double and triple checking. Make sure we didn't miss anything. Again, there's a lot of crevices. You want to use a lot of air. Make sure you didn't miss anything. It's always a good idea to do a fluoride treatment for your braces patients, your ortho patients. So you would end with the fluoride if you can, and then that's a wrap. Both on the video and the cleaning. Do your teeth feel okay?
Yeah, I feel good.
Okay, good. Thank you all for watching. Peace, love. Oh, want to do it with me?
Sure.
Peace, love, and teeth.